I'm Linda Helland. I'm the team lead for the Climate Change and Health Equity Program at the California Department of Public Health in the Office of Health Equity. And our program works to ensure that California's actions to prevent and prepare for climate change, improve health, and increase equity. We implement California's climate change policies, contributing health equity guidance, research approaches, and tools. Our mission is to build health equity, advance climate action, and improve living conditions through policy, systems, and environmental changes. Climate change impacts a wide range of direct and indirect health outcomes. We see impacts like more heat-related illness, which has historically accounted for the largest direct loss of life in California due to weather-related events. In the past 2 years, as you all know, we've seen the largest, most destructive, and deadliest wildfires in California's recorded history, which have destroyed over 33,000 structures and killed 146 people. Western wildfires are now 44% more likely than they were prior to the 1980s due to the influence of climate change, which has increased temperatures and dried out forest fuels, increasing the area burned each year in California fivefold from 1972 to the present. Nearly 100% of California's population was exposed to severe wildfire smoke at some point last year, exacerbating respiratory and cardiovascular diseases. Chronic smoke exposure causes 20,000 premature deaths each year in the United States, and that figure could double by the end of this century due to hotter, drier conditions and much longer fire seasons. Climate change leads to injury and loss of life from severe storms and flooding, as we saw in Montecito, when extreme rainfall after the Southern California fires led to mudslides. Climate change is linked to more occurrences of vector-borne diseases such as West Nile virus, and waterborne diseases such as harmful algal blooms, and with valley fever, and with an increase in foodborne pathogens such as Salmonella or E. coli. Higher temperatures increase pollen counts in many plants and lengthen the allergy season. Heat makes air pollution worse. Over 90% of the California population already breathes unhealthy levels of one or more air pollutants at some point during the year, contributing to thousands of premature deaths each year. Deep reductions in greenhouse gas emissions that also reduce air pollution could reduce air pollution mortality by 55% by mid-century. Drought affects sanitation, water quality, jobs, and livelihoods, and many of these climate change impacts also have mental health impacts. All of us are being affected by climate change, but some are most likely to be harmed. People with existing health conditions such as chronic diseases and mental illness, the very young or elderly, the unhoused, outdoor workers, some communities of color, immigrants, pregnant women, and people who have low incomes or are socially isolated are most vulnerable to the impacts of climate change. Climate change heightens health inequities as low-income people and communities of color have increased prevalence of chronic diseases that increase risks of climate-related health problems, and they are exposed to more environmental risks. Our approach is that climate change and health inequities have shared root causes in the inequitable distribution of social, political, and economic power at the root of the tree. Power is distributed based on social inequities such as racism and discrimination based on class, geography, gender, ability, sexual orientation, and immigration status. Going up to the trunk, these forces shape systems like the economy and our political system, which in turn buttress the physical and social conditions, the branches of the tree, such as poverty, housing conditions, education, transportation, and access to other services, exposure to toxins, and the fossil fuel economy, as well as the greenhouse gas emissions that drive both health outcomes and climate change, both shown as the bitter fruit at the top, manifested in severe weather, drought, rising sea levels, air pollution, and food and water insecurity, which are associated with stress, mental illness, chronic infectious vector-borne and waterborne diseases, illness, injuries, displacement, conflict, migration, and death. To illustrate how this works, in the US, billions of dollars worth of subsidies are provided to fossil fuel companies despite the majority of Americans wanting a transition to a clean and renewable economy. Fossil fuel extraction and the subsequent processing, refining, storing, delivering, and finally burning emit large amounts of greenhouse gases, as well as other gases and air pollutants that cause health problems and early death. However, this beautiful shade-giving tree represents the opportunity that climate change is offering us to remake our society at every level. Social and institutional inequities in living conditions such as income, housing, decision-making power or lack of it, and experiencing racism have the strongest impacts on health outcomes and are amenable to change through policy changes brought about through engagement, community organizing, and advocacy. Because existing poverty and inequities are associated with disproportionate harm from climate change, climate action strategies that alleviate poverty, reduce inequality, improve living conditions, and reduce health inequities will result in more climate resilient communities. Our conception of climate resilience starts with the Asian Development Bank's definition as the ability to survive, recover from, and even thrive in changing climatic conditions. And we move beyond it to movement strategy centers, understanding that the goal of climate change adaptation should not be to simply help people to bounce back after disasters and other climate effects, because the underlying conditions of inequitable political power, participation in decision-making, and access to opportunities and resources needs to be changed in order to improve quality of life, health, and sustainability. Instead, communities seek to bounce forward to a renewable, sustainable economy marked by inclusive participation in the policy decisions that affect daily life before, during, and despite climate-related events. I want to echo Ophelia from Yucca, that people of Indigenous and African American heritage have survived the kind of human-made apocalypses that we are all now facing with the climate emergency. And in surviving the attempted genocide and trauma, they and other communities facing injustices have developed assets and resilient skills that can now show the way forward. Our program produced a suite of indicators to describe climate exposures, along with indicators of population sensitivity and adaptive capacity. The data are available via an interactive website that allows users to view specific indicators, a county snapshot, or look at where climate hazards and population sensitivities overlap to increase vulnerability. This slide shows the county snapshot for San Mateo. These indicators are associated with increased risk of health harms from climate change events. I drew a red oval around the indicators that are higher in San Mateo than the state average, which are population in areas at risk of sea level rise, impervious surfaces, households without air conditioning, households without an English speaker, and population over age 65. The top indicator is sea level rise. San Mateo, as you well know, has the highest risk for sea level rise of all 58 counties in California. However, San Mateo has lower rates of most of the indicators associated with health harms from climate change, including percent without a college education, households without a vehicle, without health insurance, with a disability, violent crime rate, outdoor workers, poverty, extreme heat, and wildfire risk. This does not mean there are not pockets of these risks or small populations with these risks that still need to be planned for. We present these data on our website, but it's important, in fact crucial, to collaborate with the community, groups like Yucca, to ground truth it and prioritize needs and strategies to address them. This slide illustrates the intersection by county of a climate sensitivity, percent of population age 65 or older across the left, and a hazard, in this case population living in sea level rise inundation areas across the bottom. The most vulnerable counties appear in the top rightmost portions of the figure. Points are sized according to the population living in that county. On the far right in light purple is San Mateo County, reflecting a high rate of exposure to sea level rise inundation, 17% of the population. And that 14% of the population is 65 or older. Health effects of rising sea levels include gastrointestinal illness from contaminated drinking water, respiratory or wound infections from floodwaters contaminated with sewage overflow or hazardous substances, respiratory maladies caused by mold and flood-damaged homes, mental health issues due to displacement from home and sources of employment, and trauma. Sea level rise can exacerbate coastal flooding from coastal storms, and high tides can result in drowning, motor vehicle accidents, electrocutions, injuries, hypothermia, and stress. This slide shows percent of population 65 or older by census tract in San Mateo County, with the darker census tracts having higher proportions of older residents than the lighter colored tracts. In the tract towards the south that I highlighted here, 21.8% of the population is 65 or better, while the county average is 14.8% and the state average 11.9%. People 65 or older are more vulnerable to the health impacts of climate change. Health conditions such as cardiovascular diseases, respiratory illnesses, disabilities, and diabetes among the elderly can increase susceptibility and to the consequences of climate change. Heat waves pose exceptional risks. Older adults are more likely to suffer storm, flood, smoke, and wildfire-related fatalities than younger people. Older adults with limited mobility have increased risk of flood-related impacts. This slide shows the intersection of percent of households without air conditioning on the left, the number of annual extreme heat days projected for the time period from 2040 to 2060 across the below. The red arrow and blue box show San Mateo County, which is projected to experience about 11 extreme heat days per year by 2040, which is not a lot compared to the rest of California. But 78% of San Mateo households didn't have air conditioning in 2009, which is an important protective factor against heat-related illness. And people in coastal communities are not acclimated to extreme heat, so relative risks of harm can be higher during heat waves in communities that are used to the heat and where most people have air conditioning. Communities of color have both higher heat-related morbidity and mortality and lower access to AC. Even in households that have AC, use may be limited by financial considerations. This slide compares census tracts in San Mateo County with each other with regard to households where no one speaks English who's over 14, also called linguistic isolation. The darker tracts have higher proportions of these households compared to the lighter colored census tracts in the county. In the dark colored tract I highlighted, 23.5% of households did not have an English speaker over 14, compared to the county average of 9% and state average of 6%. Linguistic isolation may limit understanding of health and safety warnings during extreme weather events, increasing vulnerability to injury or death. Language barriers can be an issue for new immigrants and older immigrants who revert to their first language while aging. This slide compares census tracts in San Mateo County with regard to impervious surface cover. Impervious surfaces are surfaces covered by material that impedes the filtration of water into soil, such as buildings, pavements, and concrete. They retain heat, which can lead to the urban heat island effect. Communities of color are disproportionately represented in densely populated areas with more impervious surfaces due to racism and discrimination historically in redlining. Many studies have found associations between heat-related health effects and impervious surfaces, particularly among the elderly. Finally, although San Mateo has a lower population with mental disabilities, 3% compared to the state average of 4%, the projected climate impacts and vulnerabilities suggest that mental health is an important issue to plan for, as that is still 21,000 people at higher risk of mental health impacts from climate change, more likely to be harmed in extreme weather events, and to have longer lasting difficulties after traumatic events. Extreme heat increases the risk of harm for people experiencing mental health challenges, partly because they're more likely to take medicines that impair the body's ability to regulate temperature. Estimates range from about 25 to 50% of survivors of extreme weather events having some kind of mental health issue following the event, with post-traumatic stress disorder accounting for the largest share, followed by anxiety and depression. Higher temperatures increase emergency room visits for mental health outcomes, homicide, and suicide. That was a review of the climate change and health vulnerabilities that San Mateo experiences, along with our framework that taking action for the climate, if done with an equity lens, can improve living conditions, health, and well-being for all of us, and reduce inequity while increasing resilience. My later presentation will get into some climate change strategies that can result in healthy, thriving communities for all. Thank you very much.